Hello, good morning, everybody. How are y'all doing? Today, in this video, we're going to discuss a very important question related to nephrotic syndrome. A client with a nephrotic syndrome is being monitored in a medical surgical unit. Which symptom is the nurse most concerned about? Option A, significant peripheral edema. B, foamy urine. C, decreased serum albumin. D, acute onset of confusion and restlessness. In this question, we need to look at two things. First, the patient's diagnosis is nephrotic syndrome, and within this, we need to look for one of these options because it asks what the nurse is most concerned about. This means we need to look for a symptom here that indicates the patient is in some immediate danger. If we don't perform some intervention, it means that the patient might develop even more complications. So, to understand nephrotic syndrome and solve this question, we first need to see what nephrotic syndrome is. Usually, in nephrotic syndrome, we have three layers within the nephron. Inside the nephrons, like this bottom one is Bowman's capsule, and this here is the glomerulus. So the blood that comes from here is filtered in this, but not everything is filtered out of it. Some things, like water and electrolytes, get filtered through this, but proteins and blood cells will not be filtered in this. So this is what we call size and selective filtration in this. That is, inside this, we have a filtration barrier. And a filtration barrier means it won't allow everything to be filtered, it will act as a barrier for certain things. So, that filtration barrier is made up of three things. First, these small cells you see, which are the cells of this glomerulus, we call them glomerular endothelial cells. The second layer is found below these cells and forms the base of these cells, so it's called the glomerular basement membrane. And the third cell is this one, which forms the layers of this Bowman's capsule. And podocytes, meaning they have foot like processes, so we call them podocytes. All three of these layers together act as a filtration barrier. And when all three are intact, some things will be filtered from here, but blood cells and proteins won't be filtered and go down. They'll come from the afferent arteriole and then continue to circulate back into the body's circulation through the efferent arteriole. So protein won't be filtered out, and RBCs won't be filtered out either. But due to certain conditions, this filtration barrier starts to break down. As soon as it breaks down, it means that the protein that was here will leak out from here and enter this filtrate. So it will be filtered. And if this protein has come here, it means that this protein will now exit from here and leave the body. The excretion of protein from the body through urine is what we call proteinuria. This means if a patient has nephrotic syndrome, they will have proteinuria, and nephrotic syndrome means that this filtration barrier we have here gets damaged. Because of this damage, we'll see many symptoms, which is why we call it nephrotic syndrome. But what actually happens is that this filtration barrier gets damaged. Due to this damage, protein leaks out. Previously, protein couldn't pass through because the size of the protein is larger than these filtration slits. Additionally, our glomerular basement membrane has a negative charge. And protein is also negatively charged, so negative repels negative. This means when protein tries to pass through here, it gets repelled. But once it breaks down and is already damaged, protein will now leak out from here, and after leaking out, it will be excreted through the urine. And the excretion of protein through urine is called proteinuria. So this will be a symptom. When protein is excreted as the patient urinates, that protein acts as a kind of surfactant. For example, if we have water and we add soap to it, foam or bubbles are formed because soap acts as a surfactant. As soap mixes with water, it reduces the surface tension of the water, allowing air to enter. And as air enters, bubbles or foam are created, making it look frothy. The same thing happens here, because if there's proteinuria, it means there's protein in the urine, and protein acts like a surfactant. This means it will reduce the surface tension of the urine. By reducing it, as the urine is passed out, it mixes with air and forms foam. This means the second symptom will be foamy urine or frothy urine. And as protein leaks out from here, The blood moving forward into the systemic circulation will have less protein because the protein has been excreted through the urine. So, this leads to another symptom, which we call hypoalbuminemia. Hypoalbuminemia means there's not enough albumin protein in the blood. Albumin is a protein made by the liver, and it's important because it helps keep fluid inside your blood vessels. When there's a deficiency of albumin, the blood can't hold on to fluid as well, so fluid can leak out into other parts of the body. That's why, when we see low levels of albumin in the blood, we call it hypoalbuminemia. So now, this blood that's moving forward has low protein. Because the protein in it is low, we've called it hypo. Hypoalbuminemia, which means. Now, this is also actually one of its symptoms, just to be clear. So, the next symptom that we have here is hypoalbuminemia. And when we talk about hypoalbuminemia, we're referring to a lower than normal level of albumin in the blood, which is something important to keep in mind. From here, as hypoalbuminemia occurred, we saw that the more albumin there is inside these blood vessels, the more albumin we have in the blood vessels, the more the oncotic pressure will be maintained. But in our case, the albumin protein has already decreased because it leaked out, leading to hypoalbuminemia. Hypoalbuminemia. This means that from here, the oncotic pressure within the blood, the oncotic pressure in the blood vessels, has decreased. The oncotic pressure has dropped, meaning fluid will now start shifting out of the blood vessels. And whenever it shifts out, it'll shift into the spaces found between the cells. So the fluid will start shifting from here. When fluid shifts out, we call it edema. So the next symptom that will appear here is edema. Now, one thing we need to see is that as the fluid has shifted out of the blood vessels, it means that further along, these blood vessels, inside them, the fluid has shifted out, meaning it shifted between the cells into the interstitial space. So now, the volume of the blood flowing further along in these blood vessels has decreased. And when the blood volume decreases, it means that the blood pressure might drop here. And if this blood pressure has dropped, then this blood will go to the brain. And as soon as it goes to the brain, if the pressure in the blood is low, then because of that low pressure, cerebral perfusion will also decrease here. And if cerebral perfusion decreases, the patient might experience restlessness, or the patient might start feeling confused. This happened because protein leaked out, causing proteinuria, and because protein leaked out, there's less protein in the blood. With low protein in the blood, a new problem was created, which we called hypoalbuminemia, and albumin protein always maintains oncotic pressure within the blood vessels. Oncotic pressure means inside the blood vessels, and the higher the oncotic pressure, the more fluid stays inside the vessels. As the oncotic pressure inside the blood vessels decreases, the fluid will start shifting out, meaning from the blood vessels. It will shift into the cells, into the space between the cells called the interstitial space, which will cause edema. So, in these patients, we might have seen periorbital edema, which is common in patients with nephrotic syndrome. The fluid shifted out, which means that in the blood vessels ahead of us, the volume of blood has decreased. The volume decreased, which means the blood pressure has dropped. And since the blood pressure has dropped, when the blood reaches the brain, due to less blood reaching the brain, or due to low blood pressure, cerebral perfusion will decrease. And whenever cerebral perfusion decreases, the patient will experience confusion or restlessness. So, this is the most significant warning sign. A warning sign because brain cells have a chance of being damaged due to less perfusion. So, this is the most significant warning sign, the most concerning sign. And what else did we see in this? Another symptom is created in nephrotic syndrome because if the protein in our blood is low, if the albumin protein is low, then a message goes to the liver that the protein in the blood is now low. So the liver starts making protein again from here and increases the formation of protein. Among these proteins, it increases the production of all proteins, not just albumin, but all of them. Among those, there are some proteins called lipoproteins. Lipoproteins. These lipoproteins are a combination of lipid plus protein. It's a combination of both. That is, when the protein in the blood decreased, the liver started producing more protein for compensation. In that process, it makes all the proteins and also makes lipoproteins. And these lipoproteins are proteins where lipo means lipid and protein means protein. This means it contains both fat and protein together. Fat means lipid. For example, you might have seen LDL and HDL. LDL and HDL, LDL and HDL are examples of lipoproteins. So, if more lipoproteins are formed in the body, since it's like a lipid, its level will keep increasing. If the lipid level increases, it means a new problem will be created in the body, which we call hyperlipidemia. Hyperlipidemia. Hyper means high, lipid means lipid, and emia means in the blood. So we will see these symptoms in nephrotic syndrome. So, in all of this, we have to see which are the most significant warning signs. One more thing could happen. When this filtration barrier of ours, is damaged, then some anti clotting proteins from here, that is, the proteins that prevent clotting, with antithrombin 3 comes in, and it also starts leaking out. So, what will happen in this case? Besides this, other things also leak out, which we call thrombin 3 protein. This antithrombin 3, mostly prevents clotting within the blood. If it leaks out, because our filtration barrier is now damaged, it will leak out from here. Once it leaks out, it means there will now be a deficiency of this antithrombin in the blood. This means the chances of clotting in the blood will increase. And if the chances of clotting, now the blood's coagulation ability will increase. And if the coagulation ability increases, it's possible that the patient might develop deep vein thrombosis. It's possible that the clot, if a clot forms anywhere, could travel to the lungs. And if, let's say, a clot forms somewhere in the blood here, and that clot goes to the lungs, it can enter the pulmonary circulation. And if it enters the pulmonary circulation, then the blood that follows will cause hypoxia. This means there will be a lack of oxygen, leading to hypoxia. And as this low oxygen blood reaches the brain, there are chances of the brain experiencing hypoxia as well. And in that condition, it's possible that the patient becomes restless or confusion starts to set in. And if we don't treat this condition, it's possible the patient might have a seizure, or after a seizure, the patient could even go into a coma. This means these neurovascular symptoms appearing here were the most serious compared to the other symptoms. The neurovascular symptoms that have appeared here are the most serious. The chances of the patient deteriorating immediately from the others are lower, but if these symptoms persist for a long time, it means this is a sign that either the blood is getting less perfusion, meaning the blood supply to the brain itself is decreasing. This means cerebral perfusion is low. Low cerebral perfusion could mean low blood pressure. Or another condition could be that when this barrier broke, our filtration barrier, antithrombin, the things that prevent clotting, the substances we have to stop clotting, is no longer present in the body. Since it's gone, the chances of clotting have increased. A clot might have formed somewhere, and if that clot has entered the pulmonary circulation, so then the blood coming from the lungs will have less oxygen, it'll be low, which means the brain tissues will receive less oxygen here. If the brain tissues don't get oxygen, then neurological symptoms will appear. Neurological symptoms will show up. This means brain cells have very little time to survive without oxygen. So, this is the most serious condition we have. We can manage all these other things if for a short time, even if they persist, but it's crucial to treat this one first. Now, let's look at our symptoms and go back to the question. First is significant peripheral edema. As we saw, peripheral edema will occur in the patient because albumin protein is being lost through the urine, causing oncotic pressure in the blood vessels to drop. When oncotic pressure drops, fluid shifts out of the blood vessels throughout the body, moving into the interstitial space, which leads to edema. Foamy urine. This means the first option isn't so serious that we need immediate intervention. It's not an alarming sign for us. Foamy urine. Foamy urine will also occur in this patient, and it's because albumin protein has entered. Since albumin protein is excreted in the urine, it acts like a surfactant here. That reduces the surface tension of the urine, allowing air to mix in on the outside. Meaning, after leaving the body, it creates foam, it becomes frothy later, and then it results in foamy urine. So, due to albumin protein, this is also a common symptom. So, this isn't the most concerning sign here either. Neither of these is the top priority. Decreased serum albumin level. This is a common symptom of it. Whenever there's nephrotic syndrome, albumin protein will be lost. This is also a common symptom. So, we don't need to do anything immediately for this. Next is acute onset of confusion and restlessness. This means if it's acute in the patient, meaning it just happened suddenly, this acute onset of confusion and restlessness. Confusion and restlessness mean these are neurological symptoms, and neurological symptoms mean cerebral perfusion has decreased. Maybe the blood pressure's low, or there's clotting somewhere, which causes a lack of oxygen in the circulating blood, leading to a risk of hypoxia. To prevent further neurological damage, if we don't treat this condition immediately, this specific issue, and if the causative agent isn't treated, it's possible the patient might have a seizure, or it's possible the patient could go into a coma. So, the most concerning, or rather, the most concerning sign and symptom is this one right here. So, our correct answer here will be option D, acute onset of confusion and restlessness. So, what we've seen here is that in nephrotic syndrome, where protein is excreted, hypoproteinemia will occur, meaning a deficiency in the blood, and it'll be excreted in the urine, which we've called proteinuria. Besides that, the urine will become foamy because protein is present and it acts like a surfactant. So, as soon as the urine leaves the body, it comes into contact with air and creates foam, or it becomes frothy. Bubbles will form in it. Like we might have seen, when there's just normal water, bubbles don't really form in it. But when we add soap to it, the soap reduces the surface tension of that water. Then, as soon as air comes into contact with the soap and water mixture, foam is created, or bubbles form, and that's exactly what happens here. Decreased albumin is also a common symptom of this, so for this too, but the most concerning, we won't put it in the category of the most dangerous signs or symptoms, so we'll mark this as wrong too. We'll mark all three of these as wrong, but as some as there's confusion and restlessness, it means the patient's condition is about to deteriorate significantly. So this will be the most critical warning sign for us. All right? Now, we'll meet tomorrow with a new video. Thanks.